And next, the Vice President of Healthcare Association of Hawaii, Coral Andrews.
Congressman Abercrombie, thank you very much for the opportunity to be here this evening. Rich Myers sends his regards. For the purposes of the audience, I just want to share with you that the Healthcare Association of Hawaii is a trade association that represents hospitals, long-term care, home care, and hospice. So in 3 minutes, that's quite an ambitious effort to be able to give you a broad sweep of all of those entities, but I'm going to attempt to do that. We were asked to help explain, are we actually in a crisis? And I believe, Congressman, that you created the compelling case that that stage is usually set by a sequence of events at which the trend of all future events is determined. And there's instability leading to a decisive change. And I believe that the Healthcare Association of Hawaii has done its best to try to convey publicly and in each of the legislative sessions that we are already enduring a healthcare crisis. What has happened is that with the economic downturn, those investments that most of the larger health systems were able to rely on to create a buffer for the shortfalls for insufficient revenue to cover the cost of care have now been diminished. And that is what is creating this compelling case in answering the question of whether or not we're in a healthcare crisis. As I mentioned, we do represent long-term care facilities, which is a completely different structure, if you will, as you move through the continuum of care from hospitals, and then we move on down to a small business arena. So I would say that as healthcare reform is contemplated, one of the important things is that policy be set such that it recognizes that the implementation is different when you do it on a larger scale in a healthcare system than when you take that down to a small business level. And then you move it out to a rural setting, which is much different than in an urban, dense environment. Those are things that we experience here in Hawaii as you just move throughout our island chain. And I recognize that you're aware of all of these things. The next question that we were asked to speak to is, as we build a compelling case about this crisis, what's the particular problem that we've experienced in being able to provide care? For the purpose of the audience, I'd like to quickly just give you an overview of what's happened in healthcare and give you the example of why we feel that all these forces are converging at once. We produce, in conjunction with Ernst & Young, every year a study, and you can go on our website at www.hah.org and look at that study for the last 2 years. But here's just a flavor of what's happening out there in the environment of healthcare in our state. Hawaii providers have consistently experienced operating loss since 2000 of $150 million. Operating losses of $150 million in 2007, but they've had consistent losses since 2000. So while we may be looking for specific changes, what we feel is that we've just consistently been experiencing the same challenges. Therefore, healthcare reform focused in the right areas would enable us to be able to address those things. Payment shortfalls, Hawaii's overall payment as a percentage of costs, 87% is the lowest among the states, reporting to DataBank. And so again, as Congress deliberates healthcare reform, and I realize, sir, that you have one voice of many, among many, that if there's an opportunity to bring to the floor the unique nature of the smaller, more isolated areas that we experience here in Hawaii, I think that would enable us to better address our problems. Hawaii has a very unique problem called waitlist. The Healthcare Association of Hawaii prepared a report last year and this year to the legislature that we can make available to anyone who's interested. But the waitlist problem alone, so in speaking to a particular problem we faced in providing care, is a perfect case study for why things are broken. Hawaii's waitlist patient costs exceeded the payments by $73.5 million in 2008. If we can find solutions to that one problem, it's going to help stabilize the challenges that our hospitals experience and what then becomes problems outward to long-term care. Our long-term care facilities have a 95% occupancy rate. The largest problem to that is we can't generate enough investment capital to be able to create different opportunities to provide care for these waitlisted individuals. Similarly, the challenges in moving them out to the community-based settings, which is now where consumer demand wants to take them, we can't get the skill levels of the workers up enough to be able to care for them. We don't have the appropriate types of providers to be able to attend to their needs. The bad debt and charity care, you've spoken to the challenges of the uninsured. I would like to also suggest that homelessness not be unbundled as a human services issue as you begin to contemplate health care reform, because the two are wedded at the hip. Long-term care, I would request that Congress, as they look to attend to the 8 points that President Obama has laid out in his health care reform plan, to make sure that long-term care is brought to the forefront of those issues. Long-term care is something that is affecting our hospitals. It's something that moves throughout the continuum, and it aligns with the need to make sure that we're providing quality long-term care for frail, elderly, disabled Americans, which includes our veteran population. We represent home care and hospice providers, which are small businesses, and you look at the administrative burden that they bear in their overall operating pie. And what we know very acutely is in this economic downturn, their ability to continue to maintain the level of administrative burden that they've had in the past and maintain a level of services while the consumer demand continues to rise to be able to receive services in their home. They're at a point where they now are going to have to begin cutting services. And I look forward to dialoguing with you directly on this, Congressman, when I make a trip to Washington next week. So in my 3 minutes, which I have many more things I'm sure I need to share with you, I would just say this, that we're very grateful that health care reform is an issue that Congress is undertaking. Our state feels a great desire to be able to provide equal access to care to both those who live on Oahu and on our neighbor islands. And certainly we need to make sure that the benefits that are created as part of this healthcare reform package are ones that our government sets aside an adequate amount of money to be able to pay for those benefits. So that's very brief, but thank you all for the opportunity to speak.
Thank you very much, Carl. Some of the latter issues that were addressed by Carl, I think, have a particularity in terms of the human dimension associated with those statistics with the Waikiki Health Center, and I think Mark Gannon is in a good position to address exactly those issues.